Thanks for watching the ED Explained Expert Advice on Treating Erectile Dysfunction video series. Hi, I'm Dr. Jonathan Clavell, and I'm a urologist in private practice serving patients in Houston, Texas. I specialize in men's sexual health, including erectile dysfunction and Peyronie's disease. Today, I want to answer frequently asked questions related to penile implant surgery. Now here we go. Can I have an orgasm and ejaculate with a penile implant? The quick answer to this is yes, you can. But a man considering a penile implant needs to understand that the mechanisms involved with orgasm, sensation, and ejaculation are different from the erection. For example, when a man gets aroused and wants to have sex, he gets 5 things. He gets an erection, the head of the penis engorges with blood, he has sensation or enjoys what he is experiencing, he has an orgasm, and he has ejaculation. That is, semen comes out. Believe it or not, all these 5 mechanisms are different, and with the penile implant, we're only fixing one. We're fixing the erection. The rest of these things depend on the man and not the implant. Therefore, if you're able to have an orgasm and/or ejaculate now, you should be able to orgasm and ejaculate after the penile implant. Will the penile implant cause me to lose sensation in my penis? The sensation in the penis comes from the nerves that are on the top side of the penis. When inserting a penile implant, we as surgeons do our best to avoid injuring these nerves. If the surgery is being performed by an experienced surgeon, sensation should not be affected. The only thing we're doing is inserting a device to allow a man to have a strong and natural erection. Arousal, sensation, orgasm, and ejaculation in most occasions are not affected, and these depend on the man and not the implant. What most men need to remember is that the patient satisfaction with the penile implant is very high because things look and feel, again, they feel very close to natural. What is the recovery time after penile implant surgery? As with any other surgery, recovery varies on every individual. In general, this is a relatively straightforward procedure that requires a recovery of 4 to 6 weeks. This means that most men can get back to live their normal lives without restrictions and be able to engage in sexual activity by 6 weeks. However, this is something that patients should discuss with their specific surgeon prior to their surgery. Will I lose any length after getting a penile implant? This is the $1 million question. Even though there have been previous studies suggesting that men lose length with the penile implant, most experts believe that this is not necessarily true. What we do know is that erectile dysfunction and Peyronie's disease can cause men to lose length. Have you heard of the term, if you don't use it, you lose it? Well, this is somewhat true. When a man has erectile dysfunction, he stops having regular erections, and this causes the penis to lose its elasticity. The same happens with Peyronie's disease. This is a condition that causes scar to form inside the penis, and this prevents the penis from stretching out to its full capacity. Therefore, if a man has ED or Peyronie's for a long period of time, the penis will atrophy and the implant that he will get might be shorter than the erection he had when he did not have erectile dysfunction. If a man has concerns about length, he should discuss with his specific surgeon, as they might be able to show them what to expect. Will anyone visibly notice that I have an implant? Every component of a penile implant, be it malleable or inflatable, is concealed inside the body. This is one of the wonderful things about the penile implant. In most occasions, the inflatable penile implant remains flaccid while deflated and rigid when inflated. While flaccid, in most occasions, it is not visible to the naked eye. I have several patients that tell me that sometimes their partners cannot even tell they have the implant inside. So rest assured, it should be concealed. How long does the penile implant last? There have been several studies looking at the life expectancy of penile implants. In general, at 5 years, close to 90% of implants still work. At 10 years, close to 75% of implants still work. And at 15 years, 60% of implants still work. The way I explain things to my patients is that this is like buying a car, which you buy and hope that it will last you many years. But rest assured, if it fails for any reason, most of the time, it can be replaced. I am young. Will I need to get another one later in life? Given that implants do not last a lifetime, young men obtaining implants need to remember that it is likely that they might need a replacement in the future. However, this should not discourage young men from seeking a penile implant if they believe they need one. If a man is not currently satisfied with the quality of his erections and has failed medical treatment, he should focus on the fact that a penile implant will probably be the solution for his problem. Another common question is what will happen with spontaneous erections after a penile implant? So when the penile implant is inserted inside the penis, this implant will replace most of the erectile tissue, but we're not removing the erectile tissue. We're just placing the implant inside. Therefore, men need to understand that the only way they will be able to obtain a strong and natural erection going forward in order for them to be able to engage in sexual intercourse will be with the implant. If the implant is removed for any reason, he will not be able to get a spontaneous erection without the device. This is something patients should understand and discuss with their surgeon prior to proceeding with surgery. But rest assured, the implant will provide you with a strong and natural erection. Is the cost of a penile implant covered by insurance? How much does it cost if I have Medicare? Many insurance companies, including Medicare, cover the cost of the penile implant and the procedure. However, there are multiple factors that come into play when it comes to insurance coverage. If you're considering a penile implant, you should contact your surgeon's office to see if it is covered and what will be your financial obligation, if any. What are the different types of penile implants? There are currently two types of implants, the malleable implant and the inflatable penile implant. The malleable implant consists of two semi-rigid rods that are inserted inside the penis that allow a man to have an erection strong enough for penetration. The penis, however, remains semi-rigid at all times, but a man is able to bend the penis to the side when desired. The inflatable penile implant, on the other hand, consists of three parts. Two cylinders that are inside the penis, a reservoir that's in the abdomen, and a pump that is in the scrotum. This is a hydraulic system that helps a man get a strong and natural erection when inflated and a soft, flaccid feel when deflated. With the inflatable penile implant, a man has complete control of his erection. He can get it hard and keep it hard for how long as he wants to. And when he decides to, he can deflate the penis to keep it flaccid. What are the common risks of penile implants? So something that every single guy undergoing this surgery should know is talk about the common risks when it comes to this surgery. As with any other surgery, there are risks with penile implant surgery. A common risk that we as surgeons get concerned about is infection. And most research studies suggest the occurrence of these to be anywhere from 1 to 3%. When performed by an experienced surgeon, infection risks can be even lower than that. Other risks like chronic pain, malposition, erosion, autoinflation, hematoma, injury to adjacent structures, and malfunctions are rare in the hands of an experienced surgeon. Patients should discuss these risks with their surgeon. Will I have any limitations when it comes to physical activity? The inflatable penile implant contains a reservoir that in most occasions is placed in the lower abdomen. To avoid migration of the reservoir, we typically recommend patients to avoid lifting heavy objects or strenuous exercise for 4 to 6 weeks or until cleared by their surgeon. Walking should be okay. This allows your body to scar down and keep everything in place. Once the body heals, most men have no limitations or restrictions when it comes to physical activity. For any questions, visit coloplastmenshealth.com.